Here's Carolyn Jarvis.
Good evening. If a society can be judged on how well it treats its most vulnerable, then we may be failing when it comes to our elderly. Hospitals in Canada are full of aging patients, thousands of them, who should be in long-term care facilities but can't get in. As you're about to see, it's a situation that can be devastating for families and overwhelming for our healthcare system. Here's Jennifer Tryon with Hospital Heartbreak.
It's an almost unimaginable scene. A baby abandoned in the dark, crying, but nobody comes. This is the kind of image that provokes howls of outrage and brings government to its knees. Except it's not real. This, on the other hand, is. It's real-life amateur video taken inside a hospital in Mississauga, Ontario.
This is disturbing.
It is disturbing.
And for Janice Cox, heartbreaking. Her husband, Derry, spent most of his last 6 months here dying of dementia, neglected and tied down.
He's in the posy restraint. That kind of plaid thing is called a posy restraint, and then he's tied. You can see the ties down around the side, and he's been very drugged. You can see that he doesn't open his eyes throughout all of this.
It's hard to watch, but this is becoming more and more common in our nation's hospitals.
What is a bed blocker?
A bed blocker is someone like my husband who's in a hospital, should not be in a hospital. There should be another facility for him. And he's preventing other people who need active care in the hospital from having a bed.
If you haven't heard of bed blockers yet, you will. Senator Sharon Carstairs chaired a special Senate Committee on Aging. She's been studying the phenomenon for years, and the numbers are astonishing.
15,000 beds are blocked in this country.
15,000 beds are blocked.
15,000.
What do you estimate that growing to?
Oh, I think it could grow easily to 25,000 within 5 or 6 years.
You would never let a baby sit for hours and hours with a dirty diaper, not being able to feed itself, alone on a bed in a room, crying.
And if we did, we'd charge the parent with neglect. But we don't charge the hospital or the long-term care facility or the home care system with neglect. But that's what it is.
That neglect was devastating for Janice Cox and her family, especially her son, David.
I could personally work myself into a rage about what happened at the hospital. I mean, individually they put up a really good effort, but the system is just, I mean, it's not even broken because it doesn't even exist.
Trapped in healthcare limbo, the family could only watch, helplessly, as Derry deteriorated. But the man they remember deserved so much better.
We met in 1968 and married in 1970. He was, to me, a very intelligent person. And I think that's true when you are taking a degree in nuclear physics.
We're not sure about you. It might be the television line.
This is the last video of the man they knew, entertaining everyone at a family reunion in 1997. Only 2 years later, everything began to change.
Well, I'd sorted through a lot of things and thought possibly Alzheimer's, because he was forgetting things. He wasn't able to follow instructions. He was not able to problem solve.
It took doctors a few years to figure it out, but eventually it became clear. Derry had dementia.
One day he came home and said he could no longer remember how to subtract. And when you consider that he has a master's degree in science, that was one of the saddest points for me.
But how much
How much to buy one of these?
I don't know.
I don't know.
Should you go down?
Janice fought for Derry for a decade before the disease took over.
So he began to be so confused that he didn't know what a toilet was and he didn't know what the bathroom was.
He didn't know what the bathroom was, and Janice didn't know where to turn. With no spots available in long-term care, doctors told Janice the hospital was the only option.
How do you even feel watching this now?
Oh, I feel sad. I feel sad that we got to the point where we had to put him there. We didn't know it was going to be like that.
Day after day, this was Derry's life.
One time I went in and he was sitting on a chair in a puddle of urine, which to me was not an indication that they were checking on him very often to see that he was all right.
She claims Derry wasn't being properly fed, bathed, or exercised. He lost weight. He was in severe mental distress.
We were having difficulties, but nothing like this at home, for sure.
But bringing him home wasn't an option either, and there was nowhere else to go. Meanwhile, the hospital needed Derry's bed for patients who actually belonged there. They began to put financial pressure on Janice to move Derry to a long-term care facility, but there wasn't any available.
If he had been getting the sort of care that I thought he could get at a long-term care facility, I wouldn't have minded so much, but we had to pay.
For what?
I guess, I don't know.
Even though hospital care is free in Canada, Janice was forced to pay the same amount it would cost for a long-term care bed, $1,300 a month, but without any of the services long-term care offers. The hospital needed that bed so badly, she says, they even threatened to charge her $700 a day.
At one point in that 6.5 months, I just had to, felt I was like at the edge of the black hole.
Derry was finally transferred to a long-term care facility last fall. The difference was immediate and astounding.
He was moved on September 21st. And as I say, it was one of my happiest days in my life. I know I'm crying, but it was.
After 6 months in the hospital, Janice saw flashes of the man she loved. Derry even walked again.
I'm sure he felt better being there. I get very emotional about it. It was wonderful to see. It took such a weight off me.
But it wouldn't last. 2 days after Christmas, Derry died of pneumonia.
The major part of the grief for me is thinking about what not only the dementia did for him, but what those 6 months in the hospitals did to him. That shouldn't have had to happen. He shouldn't have had to go through that in the final year of his life.
Next, patients aren't the only ones suffering.
I literally would go home, get in my car, and just cry.
The devastating impact of a system under siege.
This is the new face of aging. Thousands of Canadians like Derry Cox, warehoused in hospitals, waiting for long-term care. And while they wait, they deteriorate. Cut off from the care they desperately need, taking up beds desperately needed by others. Across the country, hospitals are bursting at the seams. Busy emergency rooms and patients overflowing into hallways have become a common sight. The situation was so bad at Royal Columbian Hospital in New Westminster, BC, staff were even forced to move patients into the Tim Hortons. It's just one example of why Canada ranks 26 for hospital beds per capita among industrialized nations, well behind countries such as the Czech Republic, Hungary, and Estonia. And that crowding is not only taking a toll on patients, but healthcare workers too.
I just felt completely overwhelmed and stressed out.
For the last 10 years, Patty Bunton has been an emergency room nurse at Vernon Jubilee Hospital, a hot spot for overcrowding.
When our elderly need a place to stay when they're in their last few years,
There's no place to go.
The nurses' union there is so fed up. They've been rallying for more staff and more beds at the hospital.
I literally would go home, get in my car, and just cry.
Last year, Patty hit bottom and was forced to take a leave of absence.
And I thought, this isn't me. You know, what's happening to me? I'm generally this strong person that can handle things, you know.
She says her colleagues have so many patients who need immediate attention. Elderly patients are sometimes left unattended for hours.
For me, I'm seeing, generally I see a lot of stress, especially in the staff. So I see them during the shift coming to me going, Patty, you know, I haven't had a chance to go assess that lady, that palliative patient. I haven't had a chance because I've been busy here.
Fellow nurse Jackie Caulfield says she's often forced to make heartbreaking decisions.
We end up sometimes having to sedate these people, or they end up being restrained for their own safety, and that is difficult to watch.
Compared to what many bed blockers go through, Marlene Dutton's husband, Ian, has been fortunate.
I did not have that horrendous experience of an emergency situation happening where I had to take him to a normal hospital. I know how horrible that is.
When Ian was struck with dementia and could no longer live at home, he was taken to a special behavioral unit at a hospital in Toronto.
There was a GP, there was a neurologist, there was a social worker, there was, you know, PSWs. It was very well done.
Ian is still alive, comfortable and relatively happy in a long-term care home in Oakville, Ontario.
What did you have for lunch today?
But for families caring for loved ones with nowhere to go, it's a long and frustrating journey.
It's been 8 years that I've been living this. I was sad, and I became depressed, quite frankly.
In the midst of trying to make sure Ian was well cared for, there was also intense financial pressure and no help from the government for 5 years.
When I applied for him for disability after his diagnosis, I was refused. Like, was that fair for him? I mean, he's worked all his life contributing.
You know who I am?
You're my wife.
I am, yeah.
With no financial support and a heavy time commitment to caring for Ian, Marlene's career has also suffered.
I asked if I could work part-time because I was so exhausted.
After 6 months in hospital, Ian was finally moved to long-term care last October. But by that time, Marlene's employer had lost faith in her.
And I began to feel that I may be at risk of losing my job. There was a new boss came in in January, and I was out.
Senator Sharon Carstairs says Marlene's experience has become all too common.
We found that was consistent right straight across the country. Not enough respite care, not enough home care, not enough agencies that were able to facilitate the kind of support system and network that these individuals required.
A new model of care that could stave off a crisis.
Well, we simply must do it. We have no choice.
But is politics getting in the way of real change?
This is how Canadian hospitals have been operating for decades. When a patient has an emergency, get them to the hospital, diagnose the problem, fix the problem. The patient recovers in a bed and gets better. But with so many Canadians living longer with chronic conditions, gerontologists say that doesn't work anymore. North York General Hospital is one of only a few hospitals in the country with a strategy to tackle the specific challenges of treating aging patients. Head gerontologist Dr. Gabriel Chan says keeping seniors confined to a hospital bed often causes physical and mental damage. Sometimes they just don't recover.
So we need to train more people. They have this kind of knowledge, education, understand the situation, then they can serve much better. In fact, to look after the seniors, we need to have a lot of resources and other health professionals, apart from the medical doctors.
His goal is to keep elderly patients active and prevent them from becoming bed blockers in the first place.
Nice and tall.
Putting every possible healthcare professional a senior may need under one roof for one-stop healthcare shopping, and makes it much easier for patients like 87-year-old Dora Bromstein.
I really think that they do a good job here, and the nurses are nice.
Dora was hospitalized after falling at home. She also has Parkinson's disease. Here she gets up and walks every day, a much different experience than she's had at other hospitals.
Because the last time when I had surgery, I was in bed and quite a long time.
Good morning, gentlemen first.
Since North York began to make these changes a decade ago, there's been a 50% decrease in the number of bed blockers. But government support to expand the program has been slow in coming.
I feel frustrated for the patient because they should get this kind of care everywhere across the whole city.
Deb Matthews was returned to Ontario's cabinet as health minister on October 20th. 16 by 9 caught up with Matthews after she was sworn in. She says progress at some hospitals is encouraging, but admits there's a lot more work to do. And that includes a major overhaul of the healthcare system to better serve the needs of the aging population.
Well, we simply must do it. We have no choice. There's a lot that has to change because we have to build capacity in the community, obviously, before we let people leave the hospitals. But there's no question that we need to get into the right balance so that people get the best possible care. And if that's not in a hospital, we need to provide that care elsewhere.
But can we afford it? Senator Carstairs says, amazingly, doing a better job with seniors would actually save the system money.
An acute care bed, on average, runs anywhere from about $1,250 to $1,600 a day in this country.
It's simple math. Government pays $1,250 a day for an acute care bed versus just $100 a day for a long-term care bed. That means for the cost of keeping one bed blocker in hospital, 12 could be receiving more appropriate care in a long-term facility.
We don't need to build any more acute care beds in this country. In fact, we probably could reduce the number of acute care beds. But you can't do that overnight. You can't move that patient unless you have alternative services for that patient in the community, either through a long-term care facility or through home care services.
Carstairs has been pressing the federal government to support changes to elder care for years. She chaired a Senate committee that produced a report with several key recommendations in 2009. So, what's changed?
Well, nothing has changed.
But the federal politicians wash their hands of it and pass it on to the province.
The present federal government does exactly that. It says healthcare is a provincial responsibility. But healthcare is not a provincial responsibility. If it was, why do we have a federal Department of Health?
The number of seniors in Canada will double to more than 10 million in the next 25 years. So how we spend money on places for the elderly will determine whether any one of us spends our final days like this or like this.
Hey, stop. Derek.
Janice Cox wishes her family had been given that choice.
Should Derry's story be a wake-up call?
I would hope so. I hope when people see the difference, what the hospital experience did for him, should realize it could happen to themselves or to their loved ones.
The three of our children are here. Janice, my wife, was there.
Right here.
Oh, okay. You were there a second ago.
Next, pain without painkillers.
Они ушли, не просто ушли, они замученные.
Why so many around the world are living in agony.
Kind of plaid thing is called a posy restraint, and then he's tied. You can see the ties down around the side, and he's been very drugged. You can see that he doesn't open his eyes throughout all of this.
It's hard to watch, but this is becoming more and more common in our nation's hospitals. What is a bed blocker?
A bed blocker is someone like my husband.
Here's Carolyn Jarvis.
Good evening. If a society can be judged on how well it treats its most vulnerable, then we may be failing when it comes to our elderly. Hospitals in Canada are full of aging patients, thousands of them, who should be in long-term care facilities but can't get in. As you're about to see, it's a situation that can be devastating for families and overwhelming for our healthcare system. Here's Jennifer Tryon with Hospital Heartbreak.
It's an Alma hospital in Mississauga, Ontario.
This is disturbing.
It is disturbing.
And for Janice Cox, heartbreaking. Her husband, Derry, spent most of his last 6 months here dying of dementia, neglected and tied down.
He's in the posy restraint that
Most unimaginable scene. A baby abandoned in the dark, crying, but nobody comes. This is the kind of image that provokes howls of outrage and brings government to its knees. Except it's not real. This, on the other hand, is. It's real life amateur video taken inside